You got it. That should take care of it. Okay. Good. You can get high. I was talking with his hospital pharmacist who said one of his doctors asked him to order this drug for some cancer patients who weren't eating, weren't keeping their strength up. And he said, frankly, it isn't very good. It isn't as useful as newer drugs to encourage appetite. So he said he'd had a bottle sitting on the shelf, but it wasn't, he didn't find very many doctors were interested in prescribing the drug. Other countries, again, GW Pharmacy, the one that has Epidiolex, has Sativex, which is a combination of CBD, THC, plus other elements. It's licensed in the European Union for relieving spasticity in multiple sclerosis patients, also for intractable cancer pain in Canada. It's seeking FDA approval, but the studies apparently show varying levels of effectiveness. And again, in order to get FDA approval, it's got to be shown to be effective. And again, not a free ride, side effects reported. We've all heard about cannabis for glaucoma, and this picture, just why did I pick this picture? Just a side note. I decided rather than a picture of a pathological eye, I'd try to find the most beautiful pair of eyes I could find, because it's more fun to look at beautiful eyes than a damaged eye. So that's why, I mean, isn't this child incredible? Just look at those eyes. Cannabis for glaucoma, we've all heard that that's one of the reasons why marijuana should be legalized, is because it's a very good drug for glaucoma. Apparently it's not a miracle drug. The effects are short-lived. It must be taken up to 6 times a day. Smoking, which is, of course, the route that most people take it, affects eye pressure. So you're not going to do that if you've got glaucoma. The drug in eye drops was not absorbed well, and the oral preparations were not consistently absorbed. Now, this is something brand new. This slide I just put in a few days ago. So you're the very first ones to see this slide. What about CBD in pregnancy? There's limited data. It's not well studied. CBD is able to cross the placental barrier, and it can affect the developing fetus. It may interrupt fetal liver enzymes. We've talked before about liver effects. We'll talk some more. It may disrupt formation of synapses. Those are the connections between nerve cells. It may cause disruptions in the development of neurotransmitters. And this is all brand new. This is this year. So that's another caution. And we'll talk about that when we talk about using it with dogs. What about CBD for dogs? Let's leave the human world and get into the dog world. There's lots of interest, lots of products promoted for many conditions. There are no FDA licensed products. I just pulled this up: digestive problems, inflammation, arthritis and joint pain, anxiety and stress, seizures, pain. Almost begins to sound like snake oil. You can take it for anything. That always makes me wonder a little bit. There's limited high quality research. And by high quality research, I mean testing using a good control group, testing against the placebo. There's 2 veterinary universities studies that are studying this that I know of, that I found studies reported. One is Colorado State University's Veterinary Teaching Hospital. These studies are led by Stephanie McGrath. Small study testing the effectiveness as an add-on drug for epilepsy, not by itself, but an add-on. Preliminary findings: CBD is well tolerated in dogs. The half-life she found is 2 to 4 hours, although we know it can stay in the body a lot longer than that. Oil had the best bioavailability. The dose used for the study was 2 milligrams per pound. Earlier results are promising. She's currently recruiting pets with epilepsy for a larger study. That's Dr. McGrath. And she said, I feel really comfortable at this point, given all of our clinical trials and our initial research, that it's a safe product. But the jury's still out on whether I'm totally convinced about its effectiveness. Hardly a glowing recommendation. Cornell College of Veterinary Medicine has a small study on osteoarthritis, and I think this one's important because a lot of people use CBD for osteoarthritis in their dogs. Placebo-controlled, dogs were only allowed non-steroidal anti-inflammatories, that's like Rimadyl and Analgesic. Fish oil was also allowed in addition to the treatment. And the dose was half what they used for seizures, 1 milligram per pound. Their results, the half-life was about 4.2 hours. They did see a decrease in discomfort. That's good news. Anybody who's had an arthritic dog knows how uncomfortable they can be. They saw an increase in activity, and Colorado State University is also studying. Those are the only 2 good controlled studies that I've been able to find. Now there's tons of products from which to choose. There's oils, there's edibles. I picked the first one to display just because turmeric and black pepper capsules, okay. CBD dog treats, we've all seen those. Oil. I also picked the one that had turkey, peas, and blueberry jerky. What's that? Okay, with CBD. And I also wanted to pick up a topical cream because these are being sold, but there's no evidence, no studies that shows that CBD is absorbed topically. That is when you put it on your skin. Remember, the eye drops didn't do well either. If you're thinking of giving your dog CBD, discuss this with your veterinarian. Vets in California cannot prescribe or recommend CBD. If they're doing it informally, that's fine, but that's their choice. And the licensing board and insurance people recommend they don't. If you're thinking of doing it though, you're gonna want to ask about interactions with the dog's other drugs. For example, if you have a dog on a blood thinner, CBD can interact with that. And you want to monitor the dog's liver enzymes and bile acids before you start CBD, during the time and after. Remember that the liver enzymes can be affected. It's a temporary effect, but you still want to monitor and see what's going on. And for whatever condition you're thinking of using CBD, you want to ask, are there other drugs that your dog can really tolerate well that might be helpful? After all, whatever the condition, you want the best drug for the dog. More to think about. Don't believe claims that are not supported by good research. And as I said, in the conferences I've been to, there's a whole lot of results being suggested that there isn't good research to back up. Avoid using if your dog is pregnant or if you're considering breeding her soon. You got to remember that this can stay in the body for 10 days or more. So even if you'd stopped it and then you bred her, it could still be in her system. So give her a good break between the use of CBD and breeding her. I couldn't find anything about CBD affecting sperm. There may be good studies, I just couldn't find them. In humans, that is. And consider oil rather than any other forms. As we've mentioned before, no evidence that topicals work, which is why I had to show you this slide. This is a product that advertised bath bombs that you put in the bath water to relieve your dog's pain. Now, if your dog is like my dog, getting him to sit in a tub of warm water long enough for anything to make a difference is going to be a very neat trick. But since it doesn't work anyway, it isn't worth doing. And some more concerns. Purity is a huge concern. Because there's no regulation, you've got to check the certificate of analysis for the amount of THC in there and other things, and read that stuff, that paperwork carefully. I just pulled a picture of a certificate of analysis. Don't buy a product that doesn't give you a certificate of analysis because you don't know what's in there. So what it says is, notice the percentage of THC, 2.29 milligrams. So it's below the 0.3 standard. Talks about how much CBD is in it. But also look, and it says microbial counts, it passes. But what doesn't it say? What are the standards for passing? How much coliform, which is the bacteria found in feces, is there? How much yields yeast mold? How much salmonella? I've had salmonella. It was lots of fun. I don't want to have anything that has salmonella in it. What is their pass standard? It's not stated. And it only gives you the information of what was tested. So it doesn't say anything about other ingredients or contaminants. Just as an example, and I'm not suggesting this is in there, remember that Chinese herb I mentioned that was full of caffeine. If this did have caffeine in it, I don't think it does, we wouldn't know because it wasn't tested. So you've got to read your certificate of analysis. How much should you give? Don't rely on package directions. I love this. Serving size, 1 dropper. The labels typically suggest 0.1 to 0.5 milligrams per pound for dogs. Remember the Cornell dose was 1 milligram per pound every 8 to 12 hours for osteoarthritis. For seizures, they were using 2 milligrams per pound at Colorado State. Typically suggested human dose is between 20 and 1,500 milligrams total per day. That's not a dose, that's a range. That doesn't give you any information at all. If you're going to use it, as with any new drug, it's a good idea to start low to see how the side effects are, to see how your dog tolerates it, and to increase it very gradually. What to expect from CBD? You knew I'd put a Tverin picture in there for you. Possible side effects: increased sleepiness, decrease in appetite, diarrhea, which was commonly found in the Colorado State study, skin rash, especially in the ears, especially if you're using a topical product. Major concerns: composition of the product, as we've mentioned before. Now, I talked to the Poison Control Center folks, and they say they do get calls on CBD. They especially got a lot from Colorado after the legalization of marijuana. And they said most of the ill effects seen from CBD products, where the owner reports they gave CBD to their dog, especially edibles, are consistent with THC overdoses. In other words, the product is not what the owner thought it was. And dogs do show overdose from THC. And the most common is static ataxia. In other words, the dog has trouble standing. Lethargy, urinary incontinence, vomiting, hyperesthesia, where they're oversensitive to things. So again, know what you're getting. So in summary, there's lots of current excitement, enthusiastic anecdotal reports, as of now, limited research. It is promising for those 2 conditions, but probably not as magical a cure-all as promoted, and big concerns about purity. So go in with your eyes and mind wide open, just like this little corgi, talk about wide-eyed. My recommendations for now: don't believe everything you hear. Remember the placebo effect. Remember that when people start giving something to an animal, they tend to feel that the animal is benefiting from it. It's just like us. I could give you an M&M for a severe headache, and the studies show that 1/3 of people would feel better because of the placebo effect, up to 1/3 of people. Consider side effects. Keep your vet informed. Again, we're concerned about those liver enzymes. Look for well-designed clinical studies with control groups. Or until we learn more, if you're not willing to do the research and keep up with what's going on, please keep off the grass. All right, questions. Who's got questions? I love questions. Let's see, how do I get out of, how do I turn it back to our host? Let's see.
Can we speak up or? Yeah, just go ahead. Just go ahead and speak up, Bruce.
Okay, well, we've got a hemp product in the house called Hemp Mobility. It's supposed to help our senior. It's a chew with a lot of detail on the ingredients on it. I don't know if here it's coming out. Anyway, I was wondering, what is the? We don't really see a whole lot of effect. We see some effect, but you know, has there been any studies on this stuff? This is from Pet Honesty.
Okay, the best effects come from oils. I think one of the problem with chews is that it's hard to get the amount of ingredient exactly measured for each chew. Look at the certificate of analysis and see what it says. But the research shows that oil is absorbed better. And if you're serious about using it, I would switch to an oil product. I know the dogs love the chews. They're really easy to get them to take, but I'd sure use an oil rather than a chew if it were me.
Okay, which leads me to my second question. We also have, I'm going to see if I can illuminate this. So it's, I don't think that's going to work with the background, but it's, we do have a hemp oil. But, you know, when we've looked at hemp oil, it's like 250 milligram, 500 milligram, 1,000 milligram, 20,000 milligrams. And they always say maximum potency. And how do you know what's to get and how much to give? And, you know, and it's all based on like a quarter dropper, like there's a measurement or something.
Right. Again, I am not a veterinarian, so this is an informational talk. Banner is appearing on your screen, but the dose that Cornell used was 1 milligram per pound. And I think it was every 6 hours, if I remember correctly.
But okay, so this says 1,000 milligrams, but I don't know how much what that means. You know, if it's in a pill, I know what that means. And
right.
Then
well, look at the label and see what it says. How much per milliliter, for example? Does it say a serving size or a dose level?
Yeah, it gives a serving size.
Okay, what is a serving size?
In this case, it's a 1/4 dropper.
Which sounds like, depending on the size of the dropper, it could be 2 cc's or so. cc. Probably more like 1 cc.
Yeah, it looks like more like 1.
Okay, you're going to have to calculate how much is in each dropper full. And if the label isn't clear on that, that's not the product you want.
Well,
because
yeah, I believe you.
Because one of the big problems I have with people using it is, and this goes whether it's humans or animals, when they talk about medicinal marijuana, I say, what's your dose level? How often do you take it? And exactly how much? And they say, oh, I just light up every time I feel like it. That's not a medication. If I said, well, if you're hurting, take a handful of aspirin. Every time you're hurting, just take a handful of aspirin. And thank heavens I didn't say a handful of acetaminophen or Tylenol, because I'd be poisoning you. But that's not a medication. A medication tells you exactly what the concentration is and gives you dose levels. How much, how often. And if your product isn't, I'd look for a product that does. You got to know what you're giving your dog.
Thank you.
Okay, thank you.
So I have a question about a hemp product that I actually got through my vet.
Okay.
It's called Ellevet, E-L-L-E-V-E-T. And it was actually used in a double-blind study at Cornell.
So that may have been the product they used for their study.
Yeah.
Their,
So, and the funny thing is, I actually buy this at my vet.
Okay.
But I was wondering if you're aware of it or if you know the product.
I don't know any particular products.
Okay.
And I'm glad I don't, because I'm not in a position to recommend.
Okay.
That's out of my league. But again, if it was the product used at Cornell, we have more information about that study and that dose.
Yeah,
Maureen,
you said that.
this is John. You can find that study along with the medication that they used. I have posted it on our website.
Good, that's great.
So the link to the study is available, and I don't remember what. I know they described or they explained what they used, but I don't remember what it is.
Okay, thanks.
I have a question.
Go for it.
Is the problem, I mean, there's no good research, and I come from the same scientific background as you do, a different area, but the same sort of mentality. Is
Right.
the problem because it's been illegal for so long that the researchers were not able to study it and look at doses and responses and so forth?
I think that's part of it. I think the feeling I'm getting from the research is that it's just not that breathtaking.
Mm.
So that it may be very useful. I mean, like, look at the Epidiolex, that very unusual, terrible, constant series of seizures in small children. That's a real niche. But nobody's saying it's better than the standard phenobarbital, you know, all the things we use for seizures. And I think this is my opinion, this is me talking. I think if it were that wonderful, we'd see more studies. So my guess is if you did a real comparison study against the standard drug, remember what Dr. McGrath at Colorado State, she says, I'm convinced it's safe, but I'm not really convinced it's that effective.
Mm-hmm.
And that's kind of the subtext that I'm getting in the studies I have seen. So again, different medications work differently on different bodies. Each one of us has a different way of reacting to certain medications. Benadryl earlier, the normal dose of Benadryl would knock me flat for 24 hours, you know, be a great antihistamine because I wouldn't know if I was sneezing and snorting or not. I'd be out cold.
Right.
But that's my body. So different things are going to work well for different bodies.
Right.
And I think there will be some bodies that CBD works very well for.
I think there's a huge
Weigh in on the answer on the lack of the clinical research, because that is an area that I'm familiar with, not particularly with marijuana, but the vast majority of clinical research is subsidized by the pharmaceutical industry to
Right.
test their own products. So there's a commercial aspect to that.
Right.
Since commercialization of marijuana is so new, there has been, and it was illegal, none of the pharmaceutical companies had any particular pecuniary interest in promoting any sort of research, so they haven't subsidized it. And most academic research, except in very small studies, is also subsidized. There are now disclosures, and so you will see at the, if you read the Cornell study or the Colorado study, near the bottom of the reports in the journals, they'll talk about the ethical considerations and whether they have been subsidized by industry or how basically the research is being paid for. But I think one of the reasons that we haven't seen much in the way of either dog or human trials is that nobody wants to pay for them. There's
Exactly.
So
And
it's
it's
also in competition with the things that they really want to sell and make a lot of money for. So they
Exactly.
don't really want to do research on something that's going to interfere with their bottom line.
right.
And they can't patent it as part of the problem.
That's right.
But I
That's
do know
exactly
people
right.
who've done research on it and they couldn't publish it because it was illegal. They did some informal research, but you can't publish it if it's illegal, and you can't write grants for it.
Well, I'm certainly hoping that we will get these products off the Schedule 1 list because there'll be a lot more research. But even in Europe, where there have been products available, it's not exactly the biggest thing in the world in Europe.
You know, as far as the scheduling, I think there is an effort in parts at Film Congress to get this thing taken off of that Schedule 1.
That makes such good sense to me.
Yeah, because it's legal in so many states, and yet people are selling this Category 1 drug, and it's ridiculous.
It is. It's absolutely ridiculous. I couldn't agree with you more.
Yeah, there's a lot. It passed the House, but they don't know what it's going to do in the Senate, the latest one.
It
Yeah.
depends on Georgia.
All depends on Georgia.
All depends on Georgia.
Oh, boy.
I think it was bipartisan in the House, actually.
Good.
Yeah, I think so too.
Great.
It's gotta get done. Well, if enough of our legislators try weed once in a while, it might get through.
There you go.
Right. But my
Anybody-
15-year-old has
Anybody else?
got better appetite since he's been on the CBD oil.
Yeah.
Well, it is one of the areas where there has been some studies, and that is marijuana for cancer patients who are undergoing chemotherapy to stimulate appetite.
Oh, yeah.
Your dog has a better appetite on CBD oil. Check the label. I'll bet there's some THC in there because CBD tends to depress appetite. THC enhances it. So my guess is that there's some THC. And if it helps the appetite, great.
Yeah.
Oh,
At 15, I'm not too worried about some of the other stuff. 15 and a half.
You know, at 15 and a half, we want that dog to eat.
Well, he's only
He
eating
likes
nachos and
When I
potato
open,
chips.
yeah. I was gonna say he likes it too, whatever is in it, because when I bring him over the dropper, he opens his mouth to get it.
Which
It
dog
doesn't
are you
fit
using?
in it.
Well, Ariel is on this, and it's not slowing her appetite down at all. That's a little dog that's up there. She had a spinal cord tumor. And so it makes her very happy. I think she's not, I can't hold it up. Oh, there it is. Yeah, it's an oil, and she's getting it works out to about 2 milligrams a day. She's 40 pounds, so.
Yeah.
So it's a 2 milligrams per pound, I should say, yeah. But it's doing okay on it.
Good.
Irene, what are you giving to Mariah?
I have to possibly run down to the fridge if I can't find it in my email. Let me check real quick. So my girl is 13. We've had her for almost 3 years, and she came to us with severe separation anxiety, and also just this. She gets triggered by any activity at the front door. If you take the recycling or the trash out, very just reactive to people, not animals. And so she has this habit of barking so terribly, like it's the worst bark. Mostly, you know, if my husband's coming up and down the stairs, she adores him, but she's gonna bark at him if he comes into the bedroom. So we thought that, I thought trying different things to this anxiety, this barking must be awful for her. You know, I don't like it, my husband doesn't like it, but we'll tolerate it because we love her. But for her, you know, quality of life, if she's barking like that, there must be something, you know, bothering her to get her to bark like that. So we've tried 2 different kinds of CBD oil. This recent one was recommended by the place we get our kibble from. It's NorCal. Bruce, it's that Nature Select. That's what we.
Sure.
Yeah. So I was ordering some more kibble and just chatting about Mariah, and apparently everyone at this place gives their dogs this CBD oil, and I tried it. It's a mix in the food. It's an oil. You have to mix it in the food. No change whatsoever. The other CBD oil that was recommended. Oh, and when you were talking earlier about the vets not in California not being able to talk about CBD oil. So when I was talking about Mariah with the vet, she said, I can't prescribe CBD oil. I'm already at risk of getting, what did she say? Sanctioned or something, losing her license because she had been prescribing it previously for patients. But she said the feed store down the way, they sell it, and this is what I recommend. And it was nice of her to do that. And she did end up losing their license temporarily, and I think it was because someone was narking on her. She's a great vet. And so I went to the feed store. That one didn't. It was an oil, and that was just a drop in the mouth, no impact. I've tried the different human psych medications that the vet prescribed, and we've tried Rescue Remedy that some people just swear by.
I have not had that much of a good effect with Rescue Remedy. Apparently it does. That's another one that for individual dogs, it can work great, but in general, it's not that effective.
Yeah, I didn't find it effective for my dog or my bunny. I think it was also recommended something to do with my bunny as well. I have a bunny, and I saw no difference. And considering I'm not seeing a difference in her. Oh, and I think it did slow down her appetite, this recent one, the mix in the food. That could also be she needs some dental work that she's gonna get pretty soon. But if I don't see a change in the barking and the anxiety, I don't want to give her anything extra. So
Yeah.
I would ask your vet to check with the behaviorist at UC Davis. I obviously have not been able to go to conferences. It's one of the reasons I go to veterinary conferences, is to hear about advances in drugs for behavior. And they're not having the conferences. So I'm not up to date, but I know that they're continuing to test. And
so I would ask my vet for a referral to the behaviorist at UC Davis.
ask the vet, review the case with your vet,
Mm-hmm.
give your vet some nice notes on history and patterns and that sort of thing. And then the vet can call the behavior service at Davis.
Oh, I'd love that. I've had great history with UC Davis with the dogs and cat and
Oh yeah.
So I would love, I didn't even know that was an option. So I'll definitely bring that up.
Yeah.
Because she's 13 going on 7. She's got plenty of life left in her, and it should be the best she could ever have. So yeah. I'll check my email for that thing. They swear by it at that one company that we get the food from.
Yeah, for those of you who don't know Irene, she is Kathy Rossman's daughter. Kathy was a good friend who passed away recently.
Oh.
And Kathy has come to many of our herding trials at Evelyn's, and she's got 2 of our dogs.
Mariah
is not.
Yeah, Mariah is possibly Canadian, we think.
Wow.
We think she's maybe half Canadian, but we can't. She would be registered in Canada, and I haven't been able to get someone to track that down yet. I guess the breeder was maybe a bit of a puppy mill breeder by reputation, but but miraculously she's an amazing dog, and she's a wonderful dog, even from a puppy mill. Her owner had died, and that's how we got her, and we got her through the rescue. But Shooter is on the floor. They're both on the floor. They always, if I'm at the desk, they're right near me. Well, wherever I am.
I think she's Canadian because she's polite and courteous.
Unless she's barking. Other times she takes her treats very daintily. I would say she is decently polite, as a Canadian typically is.
She only eats poutine.
Yes.
Or she's bilingual too.
Yes, she is. and yeah, Shooter's just such a sweetheart, such an affectionate. He got weighed on Monday, 74 pounds of pure muscle.
Wow.
Yeah. I don't think there's any fat on that dog. He can knock over my husband, who's a big barrel-chested guy, and
wow,
he's such an amazing dog. And Rocky will be with us soon. He's waiting for his 3-point major to finish.
Yeah.
On my mom's deathbed, she was talking the last conversation we had, we were discussing the upcoming show that Rocky was going to be at to get his 3-point major. So we'll finish him. And so I'm getting that product really quickly.
Yeah. Most of you, with the exception of Dean, of course, probably know Karen Cowdrey. She handles Rocky for us.
She's awesome.
Great. Does anybody have any other questions or comments or?
Well, you know, I don't know. It seems like a good rescue product, but not. I'm just waiting for someone to come out and say it's good for something that's, you know, an everyday kind of thing as a supplement. But John, I have a question for you because you're a lot closer to the agility folks. The ones that are using it on their dogs, how are they using it? Are they using it as a supplement to manage pain?
Yeah, usually for sprains, muscle pulls, that sort of thing.
Okay. Well, it definitely seems to be, you know, the hot topic in dogs.
Yeah. Mm-hmm.
Well, it is, but you know, you remember a few years ago, before we actually legalized recreational marijuana, if you walk down the Venice, through Venice, I mean, there were people standing out in front of the shops saying, "Come in and get your medical marijuana." You go into the doctor says, "Do you have any aches or pains?" "Oh yeah, it hurts, my shoulder." "Yeah, I'll write you a prescription for medical marijuana." It was a scam, and
yeah,
and right now there's an awful lot of hype going on about CBD oil and the medical benefits of marijuana, and virtually all of it, as Deena told us, is anecdotal. It's people saying, "Wow, I tried this and it's great." Well, on the medical marijuana part, yeah, if you smoke THC, you are going to feel better.
I've heard the rumor.
Very true. Mm-hmm.
And you know, but if it's just the cannabidiol, then to some extent, at least, it is a placebo effect. And I'll give you an example, not CBD oil, but Jax. Some of you know my old girl Jax. She's 13 and a half now.
Yeah.
She's come down with laryngeal paralysis. Well, you know, it's an old dog thing.
No, it's like called the old man's throat.
Yeah, well,
paralysis.
yeah. Except, you know, I mean, it can be ultimately it would be fatal if she were to live long enough. But in any case, doxepin is reported to be a benefit. So I put her on doxepin for a month to see if that helped, and now I've taken her off it to determine, did it help? Did I think it helped, or did it really help? And I don't know yet. But in fact, just as an aside, there's a clinical research at Cornell about the use of doxepin on Labrador retrievers for gulp, because Labrador retrievers have a genetic component that makes them prone to it. And they're analyzing the data now, and I've asked the researcher if at some point when they have their analysis done, would he be willing to do a webinar for us? And basically at this point he said maybe.
Well, yeah, we'll find out.
Yeah.
But,
Well, I'm not changing brands on Brimmy's drops now because I suspect they have a little contamination, but whatever it is, it's working.
Hey, if it ain't broke, don't fix it.
Yeah, I got it for mobility, and I said maybe a little bit, nothing real obvious on his stiffness, but definitely helped his appetite, which has always been excellent and went off in the past year. So I guess the THC must be.
Okay.
Sometimes getting an old dog to eat is just a major try.
Mhm.
Yeah, I'm looking at my old dog right now, who's just a month or so younger than Brimmy, and she stopped eating. We couldn't get her to eat for about 3 or 4 weeks. You know, I say she ate very little. We had to hand feed her. We had to give her stuff like chicken and ham and hot dogs, and even then she'd start to turn her mouth. And now she's like the first one to, in front of the line to get fed now. So it just kind of goes in cycles.
Yeah.
The cycle thing. Because sometimes Mariah will skip a meal, and the first good 3 weeks that Shooter was with us, she was eating every meal because I think Shooter was motivating her to eat her bowl because she knew he'd probably go eat it.
Oh yeah.
Now she's starting to do that again, and then even Shooter is not devouring his bowl like he was, and the vet said it could be because they both need some dental work and maybe it's painful.
Okay,
Kids like after the dogs.
It's amazing how a dog with clean teeth can do beautifully and just be a lot more enthusiastic. I mean, sore teeth cause problems.
Yeah. When I picked him up, he'd been staying with a friend while my mom was sick, and I picked him up and I saw he had some bloody gums, and I said, "Hey, he's got some bloody gums," and she said, "Yeah, he does. I think he needs to see a dentist." So he and I know my girl needed to as well. So they got their eval on Monday, and I'm gonna make the follow-up appointments for each of them to get their dental work done.
Great.
So I bet that the appetite might come back once their mouths maybe aren't bothering them.
It doesn't hurt to eat so much, yes.
Yeah.
So I have a comment about the teeth. This is off topic, sorry, but I buy the Costco dental greenies, and I give one to each of our turfs every night. And when I take my dogs to the vet, the first thing I hear is, "Oh my God, their teeth are so clean. What do you do? Are you brushing their teeth every day?" And I said, "No, I never go near them with a toothbrush." And I swear by these things. And you can buy them in a box that has like 72 within two bags, 36 in each bag. And I give one to each dog when they're going to go to bed at night. They look forward to it. They're like, "Where is it? I want it. Go get it." And I swear by it. I mean, literally every time my dog, they just saw Arrow a couple of weeks ago, and the first thing out of their mouth was, "Oh my God, his teeth are so white. How are you keeping his teeth so white?" That's it.
Great.
So,
Yeah,
just off topic, but you might try it.
We use those too, and dogs seem to have adequate teeth.
My girl, I was giving her those greenies and she liked them at first, and then one day she puked one up, and then I've tried to give it to her after or since, and she's interested in it, but she won't eat it, and I wonder if it's because she recalls that one time she threw it up.
Well,
What's
interesting. Sorry.
Dogs are usually pretty casual about vomiting.
Oh, that I don't know why she also, I mean, she's also down 18 teeth.
Yeah.
So I
That
think
may be uncomfortable. But
yeah.
brachycephalics normally eat their food, vomit, re-ingest it. It's just
Well, then it might just be a discomfort with her teeth.
could
maybe.
be.
Yeah.
Well, the reason I tried the Costco brand is that they were so much cheaper. I couldn't afford the regular greenies, and these were so much cheaper. And then I found they liked them. I'm like, okay. So
they work just as well. We also give these rawhide chew things with chlorhexidine in them, so they're a special brand. They're little pieces of rawhide, and so it helps their teeth too.
That CBD oil that they recommended to me is CBD liposome hemp oil 300 for dogs by I guess the company Pet Relief, and leaf is spelled like Leaf.
Oh, that's the stuff I'm using for
Oh, yeah.
Ariel too, Pet Relief.
So
She's
you,
getting the stronger stuff because she's,
are you seeing a difference? What are you using it for?
Oh, she has a spinal cord
Oh,
tumor,
that's right. Yeah.
inoperable, and so we're using that. I started using it when our Turb had stomach cancer, and she is no longer with us. But, that seemed to make a little difference. But with Ariel, I think she does well on it, and if I don't give it to her, she doesn't seem to be as happy at night as she has also sundowners. So interesting combo. I don't know whether it's working better on the sundowners or whatever else she has, but she has a few problems, poor thing.
I
Little girl that's up there in my picture.
Aw. I really want it to work for the anxiety. She doesn't really have, aside from her teeth issues that she came with, she doesn't really have any other, knock on wood, any other issues, especially at her age. She's very high energy when it's time to play, and she's just a healthy dog. And it's just the anxiety, this need to bark for certain things.
We're using something on Ariel called an Assisi's loop, which is electromagnetic device, but they also make one for separation anxiety. And I don't know if that would help your dog or not. I've never used it for separation anxiety because I never had that problem, but it does seem to help Ariel for her tumor. So that's what we're using it for. But it's a little, I'll get it and show it to you. Little gadget that just, I don't know where you put it for separation anxiety. I don't know. It's a different loop.
Yeah, sure.
Yeah, so.
While we're taking a pause here, Deena, would you transfer hosting back to me, please?
So
I'm
this
trying to figure out how to do it. I haven't.
is, this
Go
is
to
the loop.
Go to the participant list,
Yes.
Right.
click on your name, and it will tell you to transfer it back.
Doesn't give me that information. Let me see.
And click on my name.
Okay. Make host. Done. You are now the host.
Wonderful.
Thank you.
Thank you. Now
Thank you for walking me through that.
Now I'll be able to make sure that the recording, I unfortunately didn't start it at the beginning. I'm sorry to interrupt you, Penny.
No, I'm done. This is Icar. This is I don't know. You can see it. This is the Assisi's loop, and it's actually a loop. But anyway, I don't know whether it's good for general anxiety, but I know that it's this different loop, and they use it for separation anxiety, and apparently it is working for some dogs. So it's another funky thing. This I had to get through our vet, but I don't know if you have to with the separation anxiety one, but it's a CCASSISI loop.
I found their website. I'll send you the link, Bruce. Maybe you can
Okay.
look.
Okay.
All right. Thanks.
He's my dog father.
Oh, okay.
Yeah.
Does
Does anybody have any other questions or comments? If not, well, thank you so much, Deena, for taking your time.
Oh, my pleasure.
The conversation was terrific. The presentation was really informative. You've done a great deal of work. I think that people will find themselves reading labels on these hemp preparations very carefully.
Seriously.
From now on.
Yeah, I want to add one thing. This is organic, and make sure you get organic because hemp is an industrial product, and some of the hemp, if you're not careful, can have all kinds of chemical additives, insecticides, all kinds of stuff. So get an organic, and there's an organic farm in Colorado that grows this stuff.
Yeah, you're right, Penny, because in the field near my house, I saw the trucks driving through the field with the big arms spraying, and I have no idea what they were spraying, but somehow I doubt it was an organic fertilizer. Let's
Yeah,
just,
I don't want to give it to my dogs anyway.
right.
Yeah. Yeah. My stuff is organic and it's from Colorado. I wonder if it's from there.
I don't know.
Great. Anybody
I
else?
did it.
Don, thanks so much for pulling this together. It was
Yeah.
very informative and I enjoyed it a lot. So thank you. And thank you,
Yeah.
Deena. Thanks.
You're very
Yeah.
welcome.
Thank you.
Good
Thank you all.
Thank you, and
Bye-bye.
good night.
Good night.
Good night.
job.